Yes, Doctor.
Morning, Doctor.
Morning. So how's your raya? Panic?
Okey je, Doktor.
Okay je. Okay, hopefully you have a good raya. Still pun beraya lagi. Nanti siapa-siapa nak datang rumah datanglah. Nak beraya ke apa ke. Okay. What is it, huh? Okay. So for today, okay, before I start the class, do you have any question on anything at all? Regarding your test 1, saya tak ambil tanda lagi. Okay. Nak tanda hari tu sebelum raya. Lepas tu banyak kerja nak settlekan sebelum raya. Tak buat lagi. Lepas tu bawa balik rumah. Bawa balik je lah. Tak sentuh pun. Okay. Ingat nak apa tu tanda dekat airport lah. Nak tanda bila-bila dah kenyang makan ke apa ke. Tak adanya lah. Tengok je lah kat tepi katil tu. Okay. So I'm still marking lah. Yesterday also marking. I woke up at 2 o'clock. I cannot sleep anymore. Okay. So there's a bit part of it lah. Just like quarter of it. A bit more. Okay. But meanwhile, okay, let's discuss on, because today's lecture is going to be quite short. Okay, today's lecture is going to be quite short. Today is going to be my lecture. Okay, and then on Friday, Prof Hair will take the lecture. Okay, it's Prof Hair's lecture, and then he requested to combine both of his lecture. He's supposed to have 2 lecture. Okay, he's supposed to have 2 lecture. Actually, it's supposed to be today and Friday. Okay, but he said he's not available, so he requested to have 2 hours lecture straight. Okay, so on Friday, your lecture is going to be 2 hours straight from 9 to 11. Okay, from 9 to 11. And then today is actually the replacement class from last Friday, because I didn't take, I have some emergency last Friday. Okay. Okay, let's go through your, saya ambil satu soalan. Final ni, final pula, your test 1 ni. Actually, many of you did very well. Okay, many of you did very well, except some of the images tu macam korang mengarut sikit lah. Okay. And then ada yang dapat almost full mark, 58 over 60, 59 over 60. So it's not too bad actually. Okay. Okay. Saya tak boleh share the screen. Tapi saya boleh baca je lah benda ni. Okay, I think the first question, the images. Okay, let me see what image is that. Okay, the image is quite straightforward. Okay, question number 1, the image is quite forward. On the right of the image is a picture of what? Bacteria colony, fried egg colony. So it's Mycoplasma already. It's just that you want to know whether it's Mycoplasma gallisepticum or Mycoplasma synoviae. Okay, since I put there a picture of a joint with caseous material, so it's Mycoplasma synoviae. If you answer Mycoplasma gallisepticum, is wrong. Ni kenapa tersilap ni? Jom saya baca. Okay, it's synoviae. Okay, question number 2 is a free mark. Okay, sebab actually terlupa. Yang tu actually for avian encephalomyelitis and encephalomalacia. Okay, so free marks. Question number 3 is a picture of histology with all the clumping of cells is syncytial cells. Okay, if you answer multinucleated cell also okay. Okay, multinucleated giant cell also okay. Syncytial cell also okay. Okay. Number 3, what is the most likely diagnosis? Since I labeled that is trachea, so syncytial cells and in the trachea is infectious laryngotracheitis. Name the agent that can cause the disease. For number 4 is a picture of lung with nodules. Okay, so it's aspergillus. And then the picture on the right is a picture of lung histology. If you look closely, it's a picture of there's a hyphae there without staining. Tapi without the picture of histology also, you should be able to answer it. Okay, because nodules on the lung. Okay, I haven't teach you Marek's disease, so the only answer is aspergillosis. Name the media to grow the agent in A. Is Seborrhoid dextrose agar or potato dextrose agar? Leads to most likely differential diagnosis for number 5. So it's a picture of gizzard with hemorrhages and hemorrhages of the intestine. So the answer should be avian influenza, Newcastle disease, or whole cholera. Also okay. The state morphological diagnosis, or that one is a picture of a heart and the heart and the liver, okay, covered with fibrin. So you should I ask for morphological diagnosis. Morphological diagnosis should be a what do you call it, a summary. So it should be perihepatitis, pericarditis, or asacolitis. Okay, any of these 3. No, 2 of these 3, then should be okay. State the morphological diagnosis for the next one is ASAC, so thickening of ASAC or asacolitis. Name of disease, any respiratory disease, you can name it, is correct. Describe the actual characteristic of inclusion bodies. I put there, I already state there, this is a pox infection. So it's not really intracytoplasmic inclusion bodies. The inclusion body also known as Bollinger bodies. Okay, it's not in the notes, but I did say it. Kalau datang kelas, okay lah. The appearance of the above should arouse suspicion of infection by, that one is, I also didn't put in the notes, but I show you at the end of the class. So it's an egg with the 8 apex abnormalities. So it belongs to Mycoplasma synoviae. Number 10, half of the flock from a local blah 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 blah. So no obvious neurologic sign. The trachea of the bird was in the image. The most likely diagnosis is infectious laryngotracheitis because they are coughing out blood. Okay, the MCQ ramai selalunya okay lah. Okay, viral disease persists in latent state is herpes virus. So herpes virus is laryngotracheitis. Which type of avian influenza can infect influenza in birds is type A. Which of the following is not true? Newcastle disease virus is avian autoavula-virus type 1, not type 2. Which of the following agent transmit vertically is mycoplasma? Reversion of virus to become virulent again, rolling effect. So it's ILT, infectious laryngotracheitis. Which infectious agent spread relatively slow is both Mycoplasma gallisepticum and ILT. ILT was suspected and no inclusion body. So, but you cannot exclude ILT because it's also in the notes, are only present in early stages of infection. After 5 days post-infection, it's a bit difficult to see the inclusion bodies. The causative agent of infectious coryza is Avibacterium paragallinarum. Yang tu senang lah, straightforward. Swab taken from cranial cleft is reliable for PCR for both Mycoplasma gallisepticum and Mycoplasma synoviae. I did mention in the class. The most common route of inoculation of embryonated chicken eggs is chorioallantoid membrane. Okay, this one pun ada nota. Okay, ini pun ada anatomy. The left and right kidneys of domestic poultry are divided into how many division? 3 and 3. Okay, I did ask in the class also. Which of the following is not true about maternal antibodies? Cell-mediated immunity. They don't have cell-mediated. Maternal antibodies is only humoral immunity. How many neuraminidase? So 11. Itu senang. Main site of replication of low pathogenic avian influenza if both A and B. Okay, is in the picture, in the notes. Which change characteristically occurs in chick embryo inoculated with infectious bronchitis virus, stunting and curling of the embryo. Ni siapa punya ni? Betul je semua ni. Yen. The main route of transmission for pox virus in chicken is vector. Okay, it's not feather dander. Feather dander is Marek disease. Festival and cheesy sickle cause salmonella. Fast-moving respiratory disease can cause swollen face with smelly mucus exudate. So I told you already, if it's smelly, okay, high chances is the infectious coryza and fast-moving some more. New emerging genotype is genotype 7. And the last one is, case 1 is avian influenza or Newcastle disease. Yang soalan short answer tu actually is exactly the same question of the quiz I give you during the class. Okay, I did ask some of you, even some of you attempt to answer it, try to answer some of it, and then some of you try to answer some of it also. So 3 predisposing factor leading to the mortality in pattern farm A. Pattern farm A is high mortality and reducing over time. So it has to do something with before the animal even arrive at the farm. Rough handling, low quality chick, stress of transportation, vaccination, rough handling, or hatchery problem. Okay. List 3 specific causes for mortality in farm B. Farm B, the mortality pattern is increasing. So it has something to do with the brooding period. Okay. Maybe the brooding temperature is not good. They got infected with diseases, poor feed, or anything lah. So they just die over time. Okay, it develops slowly. Okay, the question number 2 is related to serology. Okay, for the serology one, also I have asked in the class for the quiz. Okay, why the serology was negative. Okay, how do you explain the negative result? So the chicken are immunocompromised. Sample is taken before seroconversion. The chicken infected by different diseases, or it could be a true negative, or it could be different strain. Okay, so those are the 5 answers for this one. I got a lot of weird answer also lah. Okay. 5 advantages of live vaccine that one ada dalam nota, 6 reason for vaccination failure yang tu pun ada dalam nota, so I don't have to write. So bonus question. Okay, for bonus question is just 2 marks. Okay, you don't need this bonus question. Okay, if you answer all the previous question correct, you get 60 over 60. But if you answer this bonus question with the correct, you actually did posted, so you get extra 2 marks. Okay. Jawi, you forgot to mute.
Sorry, doctor.
Okay. Okay, so I check one by one whoever posted the, and then some of you even attempt to post it after the exam. I already locked the Putra Blast, so I know who's trying to attempt the thing. Some of you even cheated, not cheated lah. You give a fact, a very well-known fact that is quite easy, and then you want to post later. Okay, some say it's like ostriches is the only bird that cannot fly, and then he or she wants to post later in the Padlet. Dah lah, fakta tu salah. Ostrich je the only bird. Dah lah, penguin, emu, kasawari, ayam pun tak boleh fly. Okay. So tak ada markah lah untuk situ, okay? It's okay. The 2 marks is just extra marks for those that actually did the assignment lah. If you didn't do and then you did well in the exam, you can still get full marks. Okay, let's get started with the class today. Okay, let's see. Screen to share. So we have done the respiratory diseases and then also neurological diseases. Now we are moving to diseases that can cause intestinal issue, okay, GIT problem. So we'll start with 3 diseases. There's few more in the next lecture, okay. So the first one is coccidiosis, helminthiasis, and salmonellosis. Salmonellosis also I've already covered before, so I'm not covering it. So coccidiosis and helminthiasis only. So coccidiosis is found in all segments of poultry industry, so it's highly ubiquitous. It's basically everywhere. It's worldwide distribution. It's expensive and common disease. In USA, they grow about 9 billion birds per year. This one was like back then. Okay, I made these lecture notes was in 2014 or 2013. This lecture note was the lecture note that I taught US students in US. Okay, in USA, 110 millions on coccidia was spent on coccidia prevention alone. Economic losses is due to decrease in growth and increase in feed usage, because those that have coccidiosis issue, they will have to eat more. The FCR is really high. Okay, they are losing it to in the feces. Increased economic significance due to intensive confinement production system. Okay, due to high in confinement production system, when you are confined in intensive system, the feces build up is much higher. Okay, because the stocking density is higher, so they can eat their friends' feces much closer. So the etiology, the genus Emiria, okay, is the genus Emira, which infect chickens and turkey. They are highly host specific. So those that infect chickens only infect chickens, those that infect turkeys only infect turkeys. Even if you eat the Emeria, it will not cause you GIT problem. Those infect the goats, okay, there are also Emeria that are infecting goat, coccidiosis in goats, and they're only affecting the goats. Those infecting the cattle, so they are highly host specific. Immunogenic specificity also, their exposure to one species does not provide significant protection from other species of coccidia. So this is related to the protections lah. Okay, when you want to do vaccination program. So these are the species of chickens, species of coccidia in chickens and turkeys. So since you are in Malaysia, you may not want to focus more on turkey lah, but it's good to know. Okay, you want to focus more on the chicken. There are 9 species in chickens. Okay, Tenella, Maxima, Nicatrix, Acervulina, Mitis, Brunetti, Praecox, Hagani, and Mivati. However, not all of them are pathogenic. Only these 6 are pathogenic. Okay, there's 6 are pathogenic. And Praecox, Hagani, Mivati, some of them they said is like maybe it's not they just there. It's accidental findings only. Characteristics useful in identification of species, but usually you don't have to actually identify which species to that level. When you know it's coccidiosis, based on gross lesion, is usually is sufficient to start with treatments and vaccination. Okay, but if you want to characterize further into knowing what species they are, you have to send to parasitology lab, and they will check on the location of the lesions, okay, appearance of the gross lesions. Okay, some have certain type of, I will show you in the lecture later on. Oocy size, shape, and color, they are different. Size of the schizones and merozoites, location of parasites in the tissue. Okay, some are in the crypt of Lieberkühn, some of in the mucosa, in the cilia, some goes much deeper. Okay, and then pre-patent period. Okay, you have taken parasitology. What is pre-patent period? Anybody wants to answer this? Or just wait for me to ask in the exam? Incubation period, no. What is incubation period? There are pre-patent period, incubation period, what do you call it? A lot of period. What is pre-patent period? Incubation period is once you get infected until you show clinical signs. What is pre-patent? Pre-patent is basically for parasite actually. Latent period. Wait, how do I open the chat? Chat. Time to become infectious. Sort of, okay? Okay. Period between infection with parasite and the demonstration of parasite in the body. Period between infection and parasite and the egg production. Inina is most closest one. Okay, it's basically the period from the injection of the on the parasite on the eggs. Okay, until it can be detected in the feces. So you want to know the cycle. So when you know the cycle, this is important when you are designing prevention program. Okay, if it's still in pre-patent period, the eggs haven't come out yet. Okay, in chickens, for example, if they just ingested the feces, okay, the eggs is still haven't been secreted out from the body yet. So the next friend cannot eat it yet. Okay, so those are the pre-patent period. Okay, so this is basically for the parasite. Immunogenicity against reference strain. Okay, that one is immunogenicity. Okay, transmission. Resistant oocysts, they are shed via feces. They are through horizontal transmission, ingestion of viable sporulated oocysts, or mechanical transmission. Oocysts found on the litter, dust, clothes, shoe, tires, and what. This mechanical transmission is one of the main route of transmission between farms. Okay, if one person go to one farm, they pijat tai, and then go to the next farm, they drop the oocysts in the next farm. Okay, ingestion of viable oocysts, yang tu secara direct lah. Okay, this is the life cycle of the Emeria. Okay, you should know this already because you have taken parasitology. Okay, you have. If I ask you to label of this, you should be able to know lah. But I won't lah. I won't ask. Okay, but at least you should know. Okay, pathogenesis, disruption. Okay, the pathogenesis, how they cause disease is due to disruption of host epithelial cells, creates lesions in the gut, and they develop and multiply in the lesion. And then once the oocysts want to come out, so they break the cells and everything, they cause trauma to the intestinal mucosa and submucosa and cause intestinal damage. It's directly proportional to the number of sporulated oocysts ingested. So if they ingest a lot of oocysts, if in an outbreak, so they will secrete out a lot of oocysts. Okay, they will secrete out a lot of oocysts, and then their friend will eat a lot more oocysts also. So there is a cycle. Rapid recovery if lack of reinfection or development of protective immunity. So chickens can recover if lack of reinfection. They cannot be reinfected. If you remove all the feces, after that, okay, they cannot eat more. Okay, it develop a or once they develop protective immunity lah. Almost complete repair of intestinal tissue after few weeks. Okay, recovered birds still have lower feed efficiency and body weight. Will take some time for the mucosa to repair. And normal production for layer and breeders is 1 month post infection. It's usually self-limiting in nature. In many cases, okay, coccidia is just there. Okay, coccidia is just there. Coccidia is one of the normal flora. Sometimes when the chicken are stressed during rainy season, or when they are not given enough food, or it's too hot, high stocking density, or anything that can cause stress to them, they cause they are immunosuppressed. Okay, so they develop coccidiosis. And then if you remove the stressing factor, immunosuppression factor, and then they will heal by themselves usually. Okay, they are called by self-limiting. Clinical signs, so is inaptitude, weakness, poor weight gain, pale, diarrhea of soft mucus feces, bloody diarrhea if it's Emeria tenella, soil vent if you go to the farm and then all the vent area or the buttocks area, okay, is all wet, so it's indicative of diarrhea. Dehydration due to loss of fluids, mortality if it's very severe, propagation, growth, and feed conversion. There are two types of infection, clinical and subclinical. For clinical, usually they show typical symptoms of the disease, which is the diarrhea. But we have a lot of problem, okay? The main problem if they are subclinical infection, they don't show signs of diarrhea. They are not showing symptoms, but when random sample of bird examined, presence of gross lesion and coccidia are found. This is much more common and cause much more problem because we don't know they are having problem. And then the only way we know is when they don't grow well. Okay, the FCR is not good. They're not growing well. Okay, the feed conversion is not good. So these are the things that you are expected to see in gross lesion. The chickens are usually emaciated because they lost a lot of nutrients through the diarrhea. So, and then gross lesions can also be seen, okay, based on the location of the infecting parasites. Okay, the Emeria have some what do you call it, tropism for certain part of the intestine. Okay, so AVIAN acervulina infecting chickens. Zone of parasitize is the duodenum. Okay, and then usually you see light infection with whitish round like lesion or leather-like streaks. They like putih-putih, or some people call it the train tract. Okay, in heavy infection, the plaques coalescing, they stuck together and become that very thick intestinal wall. I think I have picture here. Okay, so this is how they look like. Dia macam putih-putih kat situ tu. Okay, all this white stuff. Dia like leather-like. Dia panjang juga sebenarnya, bergantung pada tu. Okay, macam ni. See in the duodenum. And then if it's very severe, okay, if it's very severe, all the white things merge together. Okay, they merge together, it doesn't look like leather-like streak anymore. They become all white macam ni, very thickened. So usually in coccidia, we also score them. We call it the lesion scoring. So we score them. This is 1, 2, 3, and 4. Oh, sorry. Saya guna dua monitor. Saya duk ke monitor satu lagi. Okay, so this 1, 2, 3, and 4. So these are the leather-like streaks. Okay, in severe cases, all the leather-like streak merge, coalescing, and become thickened. Next one is Emeria maxima, affecting the chicken. Zone of parasitize is midguts. Okay. Ni apa benda? Siapa tahu tak apa punat benda ni? Anybody knows what is this thing? Anatomy? In chicken, kalau you buka ada punat kecil. Merkel diverticulum. Yes. Okay. So what is the function of Merkel diverticulum? It's a remnant of air sac lah, yolk sac. Okay, waktu dia kecil dia ada yolk sac kat sini. So they absorb all the yolk sac from using the Merkel diverticulum. And then the Merkel diverticulum also is an indicator or landmark. Okay, how to differentiate from ileum and jejunum. Okay, sebab nanti tak tahu mana satu ileum, mana satu jejunum. So duodenum senang lah bawa dekat sini, dekat pancreas ni. And then ileum and jejunum. So you use this one. Okay, so what you see in Emeria maxima is pinpoint hemorrhages, thickened walls, mucoid, and blood tinged exudate. So this is how they look like. They're like thick wall, sometimes have blood tinged, like some drop of blood inside there. Okay, so this is how they look like in the feces. Look like feces with mucus, like mucoidy feces. Okay, if you see so much of this, and Tenella is one of the easiest one to detect lah. Okay, so zone parasitize is the cecum. So cecum ada dua kan. The onset is hemorrhages into the lumen, and then later thickening and whitish mucosa and clotted blood into the lumen. So I've seen quite a number of Tenella cases also. So what you see here, the cecum here is filled with blood. Okay, filled with blood macam ni. Okay. And then bloody feces. Okay, kalau you pergi farm, you tengok dekat lantai, lepas tu nampak blood, I mean fresh blood. Fresh blood on the litter. What are the differential if you see fresh blood on the litter? I used to ask this question in test 2. I put the exact same picture. Give 2 differential. What other thing you can see if it's fresh blood? I taught you before also this. Okay. Salmonella, not really. ILT. ILT kan dia coughing out blood. Okay, yeah, Inina. ILT, coughing out blood, so you see fresh blood in the feces. Okay. So this one, dia tak nampak feces tau, nampak blood je. Feces tu mungkin kat bawah-bawah ni. Okay. Sebab dia literally dalam dia punya in the cecum, literally like filled with blood. Okay, last time there's one case nearby UPM also in the stadium there, chickens, for research chickens, got Emeria tenella. Okay, gross lesion, and the next one is Emeria nicatrix. Zone of parasitize is midguts, pinpoint hemorrhages. You see white spots due to the schizones and mucoid bloody exudate. So yang ni pun nicatrix. Okay, in the midgut, it's quite bloody in the midgut. Okay, with mucoidy fluid. Tapi dia ni yang severe case lah, but usually you don't see that severe. Okay, sometimes they don't have like fresh blood like this. The mucosa is hemorrhagic, it's like internally, not like this. Okay. Emeria brunetti, zone parasitize is the colon area, round white lesions and leather-like lesions. So this is one as the colon area. Okay. Dan ni pun jarang nampak ni Brunetti ni. Okay. So relationship with other poultry diseases, tissue damage and changes in intestinal tract function may allow colonization by various harmful bacteria. Example, Clostridium perfringens leading to necrotic enteritis. Okay, I have seen a lot of Clostridium perfringens, and then I will ask the owner, do you have a phase of coccidia problem before? Okay, because usually the damages of intestine, okay, intestine cause a suitable environment for Clostridium perfringens to grow, the anaerobic condition. Okay, and then leads to the necrotic enteritis. Cecal coccidia, A. maternella, may contribute to increased severity of Histomonas meleagridis infection in chicken. Histomonas meleagridis is another protozoa. I will teach you later on in sudden death disease, I think. Okay, it's quite unique also because quite unique liver lesions. Immunosuppressive disease may act in concert with coccidiosis to produce more severe disease. Like I said just now, usually if the chicken are immunosuppressed, then the coccidia will flare up. In many cases, coccidia is just there. Okay, if you take a healthy chicken, you do a mucosal scraping, you will notice there's some coccidia inside there. Just because you see coccidia doesn't mean the chicken having coccidiosis. Okay, so if the number is quite a lot, then it's coccidiosis with clinical signs and whatnot. Okay. So one more thing you have to understand also, I forgot to mention just now. Okay. Clinical coccidia, we call it coccidiosis. Subclinical coccidia, we call it coccidiasis. Okay. So if they don't show any signs, it's coccidiasis. Okay. Prof may emphasize it during his lecture later on. Okay. And then the diagnosis for this disease is through clinical signs, which is the diarrhea, postmortem lesions, like I shown you just now. Histology might help if you see a lot of like oocysts, okay, in the mucosa. And if you want to do mucosal scraping, you can see different different stages of schizons, gammons, and oocysts, okay, because they are still replicating. So these are the common diagnosis lah. It's not that difficult. Sometimes clinical sign and postmortem lesion is highly suggestive already. Okay. So differential identification of each species. Okay, if you want to do lah, most of the time we never do this one. We don't really care whether what is it. So because the treatment is about the same. Different identification of each species depends upon zone of intestine parasitize, gross appearance of the lesions, oocyst morphology, minimum sporulation time, minimum pre-patent period, schizon size and location of development, and location of parasite in host intestinal epithelium. Okay, so these are the thing Emeria schizon in lamina propria. Nampak tak dia punya ni? Yang bulat-bulat ni. Sorry. Silap arrow lagi. Okay, yang bulat-bulat ni. All this rounded one. Okay, are the schizons. The whole thing. And then if you do a mucosal scraping, direct examination, you'll see oocysts. Okay, if you want to do fecal flotation, this is other oocysts. Tapi yang ni oocysts bukan coccidia kita punya ni. Ni siapa punya entah ni. Okay. Sporulated oocysts, yang ni dah sporulated lah. Oh, ni belum sporulated. Ni sporulated oocysts, dia ada 4 biji kat dalam tu. Okay. Control and prevention, anti-coccidials, live non-attenuated vaccines, and management. So first of all, management. If you have good management and everything, very low chance of to getting coccidia because they are not immunosuppressed, they are not stressed and whatnot. And then the feces build up is also less. Anti-coccidia agents are added to the feeding program and have typically been the main way of preventing coccidiosis in broilers since 1950s. We have two types. Synthetic anti-coccidial, we call it as chemicals, and the ionophores. Introduced in 1972. The ionophores are unique in they permit some cycling of coccidia to enable the bird to gradually develop a certain level of immunity. So sometimes we call it a leakage. We allow the leakage. Kita tak nak matikan semua coccidia tu. Okay? We want to allow some of the coccidia to cycle. Because as long as the coccidia is cycling in the birds, they produce some level of immunity. Okay, so that the level of coccidia don't grow so much. They don't replicate so much. So if you clear up everything, they are become virgin kind of things. And then once they don't have immunity protective level over time, and then once they get infected with coccidia, a new one, and then they get easily develop disease. Okay, these are the anticoccidial, okay, chemical and ionophores. Okay, trade name ada banyak, you tak payah hafal pun trade name. Tapi ni sebab ni US punya trade name ni. Kalau kat Malaysia kadang-kadang dia tukar nama dah. Okay, but the active ingredient is the one that commonly used. Okay, you don't have to memorize everything lah. Okay, you don't have to memorize everything. At least if I ask you to name 2 or 3, you should know lah. Okay, and then ionophores usually the end of the words is sin, all this thing. And like I said, lactulosic acid. This is an acid. Okay, yang ni je boleh confuse. Nicarbazine, tapi bukan sin tau, zin. Okay. Yang ni manufacturer pun tak payah hafal apa semua ni. Sebab banyak sangat dia punya ni products. Okay, we also have different programs to use the drugs. Straight program, we use same ionophores antacoccidia in the starter and the grower. Just finish off one. Step up program, more in the grower to protect at the time of peak coccidial oocyst shedding. Okay, and the shuttle program, chemical anticoccidia in the starter and ionophore anticoccidia in the grower. It minimizes the occurrence of anticoccidial resistance in the bird. So it really depends on the management practice. Some people use this one. Also, the drugs they use the system they use. If it's layer, house system, ataupun deep litter system. If you are in deep litter system, you have higher chances of getting coccidia. Because in deep litter system, all the feces will drop underneath the chicken and chicken like literally walking on the feces. If you are on slatted floor, okay, the feces goes down underneath. So the chances of chicken like consuming their own feces is much lesser. So you don't see much of coccidia. We also have vaccines. In Malaysia, the vaccine usage is very minimal. Okay, very minimal. For many years, the use was minimal and only used for broiler breeder replacement. Live non-attenuated coccidia might induces the immune response of the birds. There will be few lesions observed. Sometimes they use a live coccidia. Okay, non-attenuated yang lower, the strain to is of lower, what you call it, pathogenic. The lesions are required to stimulate the active immunity in the bird. Sometimes the lesion will predispose the birds to necrotic enteritis. This is very similar to IBD. IBD vaccine also can cause some sort of like bursa atrophy. Okay, because they are live, they can cause bursa atrophy. So same thing. Sometimes the vaccine itself is called predispose the birds to necrotic enteritis. Okay, this is some example of the anticoccidia vaccines. Okay, management, of course, strict biosecurity. Please make sure everybody to enter your farm, change their shoes, wash their shoes and everything. Litter management, if the condition in the chicken house allow for formation of moist or wet litter, then sporulation of oocysts is higher. So sebab tu, I always see coccidia cases, especially in backyard farmers when it's raining season. Bila raining season, dia punya tempias tu masuk tu, dia punya litter jadi basah, lepas tu dia tak tukar. And then it's a good environment for the sporulation of the oocysts. Increasing bird density could lead to stress and increased number of oocysts in the litter as well. So this is related to the management. Okay, those are all coccidiosis. Okay, next one is helminthiasis. I've seen this one also, but not very common in commercial birds. Okay, I have not seen this one in commercial birds anymore because commercial birds, their biosecurity is very good. Many of them are in slatted floor system. Okay, the chances of them getting the parasite from the ground is much lesser. But I have seen a lot of helminthiasis cases in backyard chickens. Okay, in backyard chickens. So these are some examples. Synghamus rachia, I've taught you before, in the trachea, tetramus, proventriculus, ascarids, small intestine, capillaria in small intestine, gongylonema, proventriculus in the crop and esophagus. Heterakis is one of the commonest in the ceca. Okay. So these are some of the life cycle. I think you have learned this one in your parasitology class. Okay, tapeworm. Tapeworm pun saya pernah nampak juga dalam ayam kampung few times. Okay. Roundworm is the most common. I have seen like this kind of things. Buka je terus macam Maggi keluar. Sepah. Okay. And cestodes. Okay. These are some names of the chestod, Cointania, Devania, Relatina. It sounds like a good modern baby names. Okay, siapa nak cari anak perempuan nama unik-unik boleh lah. Devania, Relatina. Okay, so these are the chestodes name. They're affecting different parts of the intestine. Trematodes. Okay, we also have trematodes. Not very common also. Flukes is what I've never seen. To be honest, I've never seen it. But there are some trematodes that are infecting chicken. Prostogonimus. Phylophthalmus grali. So if I also don't know, means I'm not going to ask in the exam also. Okay. So these are the example of trematodes. Okay, ni roundworms, tapeworms. General clinical signs. Okay, dan selalu saya nampak dekat in backyard chicken, the ones I've seen in backyard chickens are usually they just become weak, droopy, weak, emaciated. The body score is like really bad. Diarrhea may or may not present. Okay, and they die if it's very very severe. Okay, if it's very severe because they are malnourished. There are anti-helminthic treatments: piperazine, phenothiazine, hygromycin B, and butyrate. There's a lot of like anti-helminthic out there. It's almost the same as cattle and goats also. Okay. Prevention and control. Number one is sanitation, breaking the life cycle. So treatment for soil or litter to kill the intermediate host. Insecticide, because some of the hosts are the insects, the beetles inside there. Okay, the intermediate host for some of the worms. Okay, so basically sanitation lah, and then cleaning. Okay, make sure they don't eat a lot of like from the ground. Kalau you nak betul-betul prevent, you buat slatted floor lah, tak ada lah benda ni. Okay. Salmonellosis, I'm not going to cover this because I've covered this before. It's the same thing. Okay, any question? Coccidiosis in chicken, how much OPG is considered clinical? I cannot recall also lah actually for that one. Quite a number. Yang tu kena tanya parasitologist lah. Tapi if I'm not mistaken, dia tak ada macam specific number tau. Kalau macam they have a range of like, oh this macam banyak ni. And then you have to also correlate with the clinical finding. Okay, you also have to correlate with clinical finding. If you see the clinically they don't show any sign, ayam tu tak ada lah emaciated, tak ada apa pun, maybe it's still normal range. Okay, the chicken still can withstand it. Okay, but if you see a lot of diarrhea and everything, then you have to start treating it. Okay, so that one I'll get back to you. I need to check again how much of PG is considered clinical. I've been asked that one few times already, and I searched it and I forgot again. Any other question? Okay, if there is no question, I think that's all for today. It's just I want to remind you on Wednesday, on Friday, your class is gonna be a 2-hour lecture. It's Prof. Hair will take the class from 9 to 11 because he will cover everything all together. Okay, so please take note on that. And then again, siapa yang lambat tadi, selamat Hari Raya. I'll see you when I see you. Kalau ada open house, bagi tahu lah. Okay, see you guys. Bye-bye.
Thank you, Doctor.
Thank you.
Doctor.
Thank you, Dr.